This video will cover an outline of cancer staging and grading. Why do we stage and grade cancers? How cancer is staged, T&M staging, number staging, grading, when cancer is staged, and a summary at the end of everything discussed in this video. Staging and grading are used to help categorize and convey the severity of a person's cancer. Every patient who is diagnosed with cancer will undergo further tests to stage and grade their cancer. Staging relates to the size of the tumor and the extent of spread from the primary site to surrounding tissues, lymph nodes, and other organs. Grading refers to how different the cells of a tumor looks compared to normal and gives an indication of the speed that the cancer might grow at. Why do we stage and grade cancer? As a prognostic indicator, cancers of the same type can have variable outcomes depending on how far they have progressed at the time of diagnosis. Staging cancers help indicate the chance of recovery, recurrence, and spread, as well as give an estimate of life expectancy. To guide treatment decisions, cancers of the same type but at different stage can respond differently to treatment. Therefore, the stage and grade of cancer help dictate what intervention has the best chance of working and how aggressive the treatment plan needs to be. To assess spread, the process of staging involves imaging parts of the body that the cancer may have metastasized to. This helps plan management. To identify appropriate clinical trials. Clinical trials accept specific groups of patients, and often one of the specifications is the stage of cancer. How is cancer staged? Several different investigations can be used to help stage cancer depending on the type. These include imaging such as X-ray, CT, MRI, PET, and ultrasound scans. These help to assess the size of the tumor, the location, the structures involved, and size of metastasis or lymph node spread. Biopsies. Various types of biopsies might be taken, including wedge, punch, fine or core needle, and excision biopsies. These are then sent to histopathology to study the cells of the sample tissue. This is particularly important in determining the grade of cancer. Blood tests. These might be used to detect levels of certain tumor markers, which is used in the staging of certain cancers. For example, the levels of prostate-specific antigen, PSA, is used in the staging of prostate cancer. There are multiple different staging systems available, and some are specific to the certain cancer types, such as the FIGO staging system for gynecological cancers. The most common staging system used for cancer are the T&M staging system and the number staging system. The T&M system is made up of three categories: T, N, and M. T refers to the primary tumor and its size. T0, there is no evidence of a primary tumor. TIS refers to a carcinoma in situ. TX, the primary tumor is unable to be assessed. T1, T2, T3, T4. These refer to the size of the tumor and the structures that it has spread to. T1 is the smallest and least invasive category, whilst T4 is for the largest tumors or those that have invaded multiple structures. The specific size and structures invaded that define each category are unique to the type of cancer. N refers to the spread of cancer to the lymph nodes. NX, lymph nodes cannot be assessed. N0, no spread to lymph nodes. N1, N2, N3. The number increases with the number of lymph nodes the tumor has spread to. N1 means one or very few lymph nodes, and N3 means many. M refers to whether the cancer has metastasized to other parts of the body. M0, there are no metastases found. M1, the cancer has metastasized to a distant site. As an example, a cancer stage T1, N0, M0 would refer to a small tumor that has not spread to any lymph nodes and has not metastasized. The number staging system. The number system uses the TNM system and divides cancer into separate stages. These stages vary with the type of cancer, but there are typically four, 1 to 4, that may be split into substages labeled with a letter A, B, or C. Each stage increases in severity as the number increases, and they typically follow the trend. Stage 1. The tumor is small and contained within the organ it originated in. Stage 2. The tumor is larger than in stage 1, but the cancer has not started to spread to surrounding tissues. Sometimes, stage 2 means the cancer cells have spread to lymph nodes close to the tumor. This depends on the cancer. Stage 3. The tumor is larger. It may have started to spread to surrounding tissues, and it has spread to lymph nodes nearby. Stage 4. The cancer has spread from where it started and metastasized to another body organ. It is important to note that this is a generic guide, as specific cancers will have specific criteria for each stage. The grading system. Similar to the staging systems, some cancers have their own specific grading system, such as the Gleason system used in prostate cancer. However, the most commonly used classification is GX, when the grade cannot be assessed, G1, well differentiated, or low grade. The tumor cells look like normal cells and are growing slowly. G2, moderately differentiated, or intermediate grade. The tumor cells look abnormal and are growing quicker compared to normal. G3, poorly differentiated, high grade. The tumor cells look very abnormal and are growing a lot quicker compared to normal. When is cancer staged? As mentioned before, every patient has their cancer staged following a diagnosis. However, it can also be staged again at a different point, with different notations to represent this. These times are as follows. Clinical stage. This is the stage given before treatment has started and is based on imaging and laboratory results. It is sometimes represented by a lowercase c in front of the TNM stage. For example, CT2. Pathological stage. This is used if surgery is done as the first treatment and combines the information gained from tests before surgery with the information gained from the specimen removed. This stage is denoted with a lowercase p in front of the TNM staging. For example, PT3. The pathological stage may vary from the clinical stage in instances where imaging has not shown the true extent of size or spread of the tumor. Post-neoadjuvant stage. This is the stage after neoadjuvant chemotherapy or radiotherapy has been completed and is represented by a Y in front of the TNM staging. For example, YT2. Staging can be done again once the tumor has been surgically removed and is indicated with a YP in front of the TNM stage. For example, YPT3. Recurrent stage. If a cancer comes back after treatment, the recurrence can be staged. This is represented by a R in front of the TNM stage. For example, RT1. It is important to note that when a cancer is restaged, the new stage does not replace the original stage, but is added to it. To summarize, staging is very important and plays a huge role in guiding treatment. There are multiple systems to stage cancer. with TNM and the number staging systems being the main ones. The exact specifications of each system is customized to each type of cancer. The grade of a cancer is important too. Cancers can be restaged at different points, but this does not replace the original staging. A general rule is that the number for staging and grading increases the poorer the prognosis and higher the severity of the cancer is.